Q&A random selection. Number 12. 21. The nurse is teaching parents of an infant about introduction of solid food to their baby. What is the first food they can add to the diet? A. Vegetables. B. Cereal. C. Fruit. D. Meats. 21b. Cereal is usually introduced first because it is well tolerated, easy to digest, and contains iron. 22. During seizure activity, which observation is the priority to enhance further direction of treatment? A. Observe the sequence or types of movement. B. Note the time from beginning to end. C. Identify the pattern of breathing. D. Determine if loss of bowel or bladder control occurs. 22a. Observe the sequence or types of movement. It is a priority to note, and then record, what movements are seen during a seizure because the diagnosis and subsequent treatment often rests solely on the seizure description. 23. The nurse is caring for a client with a sigmoid colostomy who requests assistance in removing the flatus from a one-piece drainable ostomy pouch. Which is the correct intervention? A. Piercing the plastic of the ostomy pouch with a pin to vent the flatus. B. Opening the bottom of the pouch, allowing the flatus to be expelled. C. Pulling the adhesive seal around the ostomy pouch to allow the flatus to escape. D. Assisting the client to ambulate to reduce the flatus in the pouch. 23b. The only correct way to vent the flatus from a one-piece drainable ostomy pouch is to instruct the client to obtain privacy. The release of the flatus will cause odor, and to open the bottom of the pouch, release the flatus and close the bottom of the pouch. 24. A nurse who travels with an agency is uncertain about what tasks can be performed when working in a different state. It would be best for the nurse to check which resource. A. The State Nurse Practice Act in which the assignment is made. B. With a nurse colleague who has worked in that state 2 years ago. C. The policies and procedures of the assigned agency in that state. D. The Nursing Social Policy Statement within the United States. 24a. The State Nurse Practice Act is the governing document of the scope of practice in the given state. 25. The parents of a 7-year-old tell the nurse their child has started to tattle on siblings. In interpreting this new behavior, how should the nurse explain the child's actions to the parents? A. The ethical sense and feelings of justice are developing. B. Attempts to control the family use new coping styles. C. Insecurity and attention-getting are common motives. D. Complex thought processes help to resolve conflicts. 25a. The child is developing a sense of justice and a desire to do what is right. At 7, the child is increasingly aware of family roles and responsibilities. They also do what is right because of parental direction or to avoid punishment. 26. Which of these principles should the nurse apply when performing a nutritional assessment on a 2-year-old client? A. An accurate measurement of intake is not reliable. B. The food pyramid is not used in this age group. C. A serving size at this age is about 2 tablespoons. D. Total intake varies greatly each day. 26c. A serving size at this age is about 2 tablespoons. In children, a general guide to serving sizes is 1 tablespoon of solid food per year of age. Understanding this, the nurse can assess adequacy of intake. 27. A client with HIV infection has a secondary herpes simplex type 1, HSV1, infection. The nurse knows that the most likely reason for the HSV1 infection in this client is A. Immunosuppression. B. Emotional stress. C. Unprotected sexual activities. D. Contact with saliva. 27a. Immunosuppression. The decreased immunity leads to frequent secondary infections. Herpes simplex virus type 1 is an opportunistic infection. The other options may result in HSV1. However, they are not the most likely causes in clients with HIV. 28. The nurse is preparing to perform a physical examination on an 8-month-old who is sitting contentedly on his mother's lap. Which of the following should the nurse do first? A. Elicit reflexes. B. Measure height and weight. C. Auscultate heart and lungs. D. Examine the ears. 28C. Auscultate heart and lungs. The nurse should auscultate the heart and lungs during the first quiet moment with the infant so as to be able to hear sounds clearly. Other assessments may follow in any order. 29. A client is unconscious following a tonic-clonic seizure. What should the nurse do first? A. Check the pulse. B. Administer Valium. C. Place the client in a side-lying position. D. Place a tongue blade in the mouth. 29C. Place the client in a side-lying position to maintain an open airway, drain secretions, and prevent aspiration if vomiting occurs. 30. The nurse has been assigned to 4 clients in the emergency room, each experiencing one of these conditions. Which client condition would the nurse check first? A. Viral pneumonia with atelectasis. B. Spontaneous pneumothorax with a respiratory rate of 38. C. Tension pneumothorax with slight tracheal deviation to the right. D. Acute asthma with episodes of bronchospasm. 30C. Tension pneumothorax with slight tracheal deviation to the right. Tracheal deviation indicates a significant volume of air being trapped in the chest cavity with a mediastinal shift. In tension pneumothorax, the tracheal deviation is away from the affected side. The affected side is the side where the air leak is in the lung. This situation also results in sudden air hunger, agitation, hypotension, pain in the affected side, and cyanosis with a high risk of cardiac tamponade and cardiac arrest. 31. The nurse measures the head and chest circumferences of a 20-month-old infant. After comparing the measurements, the nurse finds that they are approximately the same. What action should the nurse take? A. Notify the provider. B. Palpate the anterior fontanelle. C. Feel the posterior fontanelle. D. Record these normal findings. 31D. Record these normal findings. The rate of increase in head circumference slows by the end of infancy, and the head circumference is usually equal to chest circumference at 1 to 2 years of age. 32. A 2-year-old child has recently been diagnosed with cystic fibrosis. The nurse is teaching the parents about home care for the child. Which of the following information is appropriate for the nurse to include? A. Allow the child to continue normal activities. B. Schedule frequent rest periods. C. Limit exposure to other children. D. Restrict activities to inside the house. 32A. Allow the child to continue normal activities. Physical activity is important in a 2-year-old who is developing autonomy. Physical activity is a valuable adjunct to chest physical therapy. Exercise tends to stimulate mucus secretion and helps develop normal breathing patterns. 33. The nurse understands that during the tension-building phase of a violent relationship, when the batterer makes unreasonable demands, the battered victim may experience feelings of A. Anger. B. Helplessness. C. Calm. D. Explosiveness. 33B. Helplessness. Battered individuals internalize appropriate anger of the batterer's unfairness. They feel depressed, with a sense of helplessness, when their partner explodes, in spite of their best efforts to please the batterer. 34. When counseling parents of a child who has recently been diagnosed with hemophilia, what must the nurse know about the offspring of a normal father and a carrier mother? A. It is likely that all sons are affected. B. There is a 50% probability that sons will have the disease. C. Every daughter is likely to be a carrier. D. There is a 25% chance a daughter will be a carrier. 34D. There is a 25% chance a daughter will be a carrier. Hemophilia A is a sex-linked recessive trait seen almost exclusively in males. With a normal father and carrier mother, affected individuals are male. There is a 25% chance of having an affected male, 25% chance of having a carrier female, 25% chance of having a normal female, and 25% chance of having a normal male. 35. The nurses on a unit are planning for stoma care for clients who have a stoma for fecal diversion. Which stomal diversion poses the highest risk for skin breakdown? A. Ileostomy. B. Transverse colostomy. C. Ileal conduit. D. Sigmoid colostomy. 35A. Ileostomy output contains gastric and enzymatic agents that when present on skin can denude skin in several hours. Because of the caustic nature of this stoma output, adequate peristomal skin protection must be delivered to prevent skin breakdown. 36. A client is admitted for hemodialysis. Which abnormal lab value would the nurse anticipate not being improved by hemodialysis? A. Low hemoglobin. B. Hypernatremia. C. High serum creatinine. D. Hyperkalemia. 36A. Low hemoglobin. Although hemodialysis improves or corrects electrolyte imbalances, it has no effect on improving anemia. 37. The nurse is teaching a client who has a hip prosthesis following total hip replacement. Which of the following should be included in the instructions for home care? A. Avoid climbing stairs for 3 months. B. Ambulate using crutches only. C. Sleep only on your back. D. Do not cross your legs. 37D. Do not cross your legs. When the client is immediately post-op, hip flexion should not exceed 60 degrees, and after discharge it should not exceed 90 degrees. 38. The nurse is assessing a client with delayed wound healing. Which of the following risk factors is most important in this situation? A. Glucose level of 120. B. History of myocardial infarction. C. Long-term steroid usage. D. Diet high in carbohydrates. 38C. Long-term steroid usage. Steroid dependency tends to delay wound healing. If the client also smokes, the risk is increased. 39. A 7-year-old child is hospitalized following a major burn to the lower extremities. A diet high in protein and carbohydrates is recommended. The nurse informs the child and family that the most important reason for this diet is to A. Promote healing and strengthen the immune system. B. Provide a well-balanced nutritional intake. C. Stimulate increased peristalsis absorption. D. Spare protein catabolism to meet metabolic needs. 39D. Spare protein catabolism to meet metabolic needs. Because of the burn injury, the child has increased metabolism and catabolism. By providing a high carbohydrate diet, the breakdown of protein for energy is avoided. Proteins are then used to restore tissue. 40. A client was admitted to the psychiatric unit after refusing to get out of bed. In the hospital, the client talks to unseen people and voids on the floor. The nurse could best handle the problem of voiding on the floor by A. Requiring the client to mop the floor. B. Restricting the client's fluids throughout the day. C. Withholding privileges each time the voiding occurs. D. Toileting the client more frequently with supervision. 40D. Toileting the client more frequently with supervision. With a client suffering from altered thought processes, the most appropriate nursing approach to change this behavior is by taking an active role in attending to the physical need.